Hi folks, here is a variety of cannula varying from 14 gauge to 26 gauge. And the last two cannula that are the smallest. Yellow is 24 gauge for pediatric and purple is 26 for neonatal. So the majority of used cannula for adults, that's 14 gauge, which this is the biggest cannula. The 16 gauge is gray, the 18 gauge is green, 20 gauge is pink, and the last is 22 gauge is blue. So disposable tray should contain the chlorhexidine prep, tourniquet, and normal saline for flushing the cannula, some gauze and tape, and of course some cannula. And make sure you got a sharp box nearby. So we've got here a fake blood, and choosing the cannula and the site is very important in succeeding the cannulation. So make sure you got disposable tray, and firstly put non-sterile gloves, and the tourniquet must be applied 5 to 10 centimeter above the point of entry, and the distal post must be felt. Firstly, you have to clean the side with chlorhexidine prep. As you can see, this is a tube full of alcohol 2%, and squeeze it, then the fluid will dispose in a sponge. When you start cleaning the side of the cannula, make sure start from the middle and turn it as a circle from inner to outer, from clean area to dirty area. Then open the cannula chosen for the procedure. So there's a preference how to hold the cannula, by holding by the wing or squeezing the wing. This is up to you. So take the cap off. By making traction, so the traction needed, and stretching the skin below the entry point. So firstly I want to show you the bevel should be facing up. Once you choose the vein, within few meters, once it's in, you can see the chamber here is already full of blood already. So you know that there was succession by introducing the cannula a bit further. As you can see, the chamber is already full of blood. But before taking the capsule, release the tourniquet. Then make sure put a bit of dressing underneath to have less mess. So take the cap off and put it on the side and press on entry point with the port. Then take the sharp out as you can see the tip. This is the security tip. Once you take the needle out, it won't go back. That's for safety mechanism. And put the cap on back and clean around the side of the cannula. Then put in a dressing on and squeeze these three. The first one is just put a date and time, and these two sticker you can put it like a parallel on the side of the wing or put them cross. It's up to you. It's not easy to put the dressing on a dummy, and in human being is better. I'll try my best here. So by pressing down and taking the cover from the dummy, it's not easy, but on human it's easier. So as you can see, a bit's been struggling here. Not easy on a dummy. Okay, I found here a side here. So take just the cover out. By pressing the dressing, and just take the excess of the dressing out, and just the stick label, which has got a date and time, and make sure the sharp bit goes to the sharp box. And don't forget to flush the cannula, making sure that the vein is patent. Otherwise, if it's not in, it will hurt. And making sure when you flush the saline, make sure put it on a port, not on entry point though. By flushing it, look at the vein if it's patent by flushing the saline in the vein. By removing the cannula, always wear non-sterile gloves. Remove the IV dressing. Please do not use scissors. Once the dressing is taken out, hold a gauze over the site and remove the cannula by applying firm pressure 2 to 3 minutes until bleeding subsides. Maybe be longer if it's the patient is on anticoagulant. And make sure to get rid of the camera in sharp box. and always the hands must be decontaminated following the removal of end of the procedure. There's some tips some tips how to choose the veins. Always look at the vein before you put a tourniquet, traction and stretching the skin. As you can see, some of them comes in Y shape, some of them come in a long vein, and on the side of, you can even choose the side of the vein, side of the arm, hand, and on the back of the hand as well. It's not easy to put the cannula the patient on a patient because the artery is nearer to the vein. So if you like the video, please don't forget to like and subscribe.